today's video, we are going to be talking about the pros and cons of working in long-term care. Stay tuned. What's up, you guys, and welcome back to my channel. For those of you who are already part of the family, for those of you who are new, welcome. My name is Selena, and this is my channel, Nursing with Key, where I mainly make nursing related videos, but we also incorporate a little bit of beauty and hair. So if you're into those things, make sure you hit that subscribe button and turn on your notification bell so you won't miss another video from me again. So I got a question from a nursing student who is about to graduate very, very soon, and she was basically asking me if she needs to work in acute care or in a hospital setting as a new grad nurse, right? She's scared of kind of going into long-term care, and she just wants to know, like, what is in it for her if she does go into long-term care. So I'm not gonna sit here and make long-term care seem as though, you know, it's just the perfect place to be, because obviously there's pros and cons everywhere, but I just wanted to address those pros just in case some of you guys didn't know, and talk about the cons as well. So let's get into the video. So the first one I'm going to mention is based off of my personal experience. I was working in acute or in a hospital setting, and I left for long-term care. I did make a video about why I quit working in the hospital, so if you haven't seen that, I'll leave it in the end card or down in the description below. But it is a good way to ease yourself into working as a nurse independently, right? As a nursing student, we are constantly supervised by preceptors or teachers. We're never really working independently, even if it is your last clinical rotation. I remember on my very last rotation, my teacher was letting me do things independently. You know, I was doing blood draws on my own, but she would still kind of like peek in on me and stuff like that. Another thing is also because as a nursing student, the workload is way less than it is as an actual nurse. I know for me, in order for me to successfully pass my clinical rotations, I had to be able to manage a total of 4 patients. Now that can literally quadruple as a nurse real quick, and more than that even. You could go from having 16 patients all the way to I have a nurse friend who told me she had 64 patients, and I was like, what? Like, I don't know how she's doing that, because I think the most I've had is like maybe 30 or 40 or something, and I thought that was pretty challenging. But to go from 4 patients or 5 patients to 16, 20, 30 patients is really, really tough, especially if you're working in a hospital and everybody has IVs beeping, peg feedings beeping, all types of stuff beeping, call bells, injections to give. So I'm not saying that long-term care is easy, but it is a little bit slower. You know, the pace is a little bit easier, in my opinion, than in a hospital. So if you are a new grad nurse, I do think that working in long-term care is a good way to kind of ease yourself into the field, into working independently. And it's a really good way to kind of learn time management, right? If you get into long-term care and you kind of get the hang of having 30 patients, then it'll be a lot less challenging for you than when you go into the hospital and you have 30 patients thrown at you. So that's number one. The second one is that it's a good place to kind of practice your nursing skills before going into acute care. I know that, you know, on clinical rotations, we do practice our nursing skills a lot. However, we can only practice what is available, right? If nobody has a peg tube, well, your teacher can't ask for one to be inserted, or for a patient to get a peg tube so that you can practice, right? So we kind of practice with whatever is there. And sometimes there's skills that you're gonna have to practice, or there's skills that you're gonna have to do for the first time by yourself as a nurse that you never got the chance to practice in clinicals. So I think it's a really good way to like practice, because like I said, the pace is a lot slower. In a hospital, nurses are on the go. They're like constantly rushing. And yes, there is some type of rush as well in long-term care, but like I said, the pace is much slower. And so if you do not know how to do something, a nurse, you can go ask a nurse, and the nurses in long-term care will have kind of more time to help and guide you than a nurse in the hospital setting, if that makes any sense. I'm not saying that if you work in a hospital that nurses are going to completely ignore you and they're not going to want to help you. That's not what I'm saying at all. But I'm just saying, because the pace is slower in long-term care, I think it's much more of a better learning environment than the hospital setting, if that makes any sense. Guys, for those of you who understand what I'm trying to say, please break it down in the comment sections in the comment section below, because I don't know. Third one is that it is easier to get into, especially if you are an LPN. I know here in Canada, LPNs get a lot of jobs in the hospital. They really, really do. But I know that in the States, and I'm saying that because most of my viewers are from the States, getting into the hospital is a lot more challenging for LPNs than it is for RNs. I'm not saying it's impossible. That's not what I'm saying. I'm just saying it's more challenging, especially if you are an LPN. So if you want to, get working and you want to get practicing your skills and you really want to get into the game as fast as possible, you can apply at a hospital, but you're more likely going to get a call back faster from a long-term care facility. And that's fine. You can work in your long-term care facility and you can continue to apply at jobs at hospitals until you do get a call back. And if you do get a call back and you choose to leave, then you are free to leave. But if you, like I said, if you want to get to the money real quick, then you should start off with long-term care. There's nothing wrong with starting off with long-term care. You will be able to practice your skills. You'll be able to, like I said, ease your way into the field. And then if you get a call back from a hospital, then you are free to go, obviously. And the next thing is that you can make good money working in long-term care. And the reason for that is because everybody wants to work in a hospital. Everybody wants to work in a hospital, and long-term care facilities know this. And so they are increasing their salary, giving nurses more money to come and work for them, because they know not a lot of people want to work in long-term care. Some people like it, but most people want to work in a hospital setting. And like I said, because of that reason, long-term care facilities are paying good money. They're paying good money to nurses so that they can come and work for them. So now we're going to get into the cons. I wasn't able to really think of much cons, so if I forgot anything, like I always say, leave them down in the comment section below. But I came up with 3 main cons, and we're going to talk about that. So the first con is that it can be very repetitive, and for that reason, it can become very boring very quickly. So if you're the type of nurse who just enjoys a really good adrenaline rush, right? The ER would be the perfect place for you, because you're seeing, all these different cases, people are coming in, different situations, and you're just always on the ball and things are always happening. Like, that is not what you're going to experience in long-term care. In long-term care, people are sick, but they are stable, right? In the hospital, you are trying to restore a person's health, whereas in long-term care, you are maintaining it, right? So you're giving them their medications that they have been on for 20 years because they have hypertension, or you're giving them the insulin that they've been getting for 20 years because they are diabetic, and they've been diabetic, for how many years. The most that'll happen is their insulin dose might change, or the medications that they're taking, the doses of their medications that they're taking might change, or you might get 1 or 2 add-ons. But for the most part, like, everyone's condition is pretty stable, and so you are seeing the same thing every day. Nothing is ever really new, unless somebody's condition really declines, and then it's like, okay, well, you have a bit of an adrenaline rush because, I don't know, somebody's sitting at 85, you might have to give them oxygen, or, somebody stops breathing, you might have to do CPR, but at the end of the day, you still have to call the ambulance, and then the ambulance will take them to the hospital. So it's like, you deal with the adrenaline rush for, a little bit, and then you ship them off to the hospital where they can get the care that they need. And it can kind of suck for you because you might want to be part of that process, but you don't get to be part of that process in long-term care. Sorry. Another thing, and this depends on where you work, because there's different long-term care facilities are not all the same, right? So you have long-term care facilities where patients are much sicker, and then you have long-term care facilities where people, really just have cognitive issues, but overall they're able to walk. They don't have any IVs, they don't have any pegs, they don't have anything like that. They just need to be given their medication. And that's a really bad thing, because if you work in a facility like that, it's easy for you to kind of lose your skills if all you're doing is just giving people meds, taking their vital signs, and giving them insulin. If that is all you're doing in your facility, you can easily lose your skills. And yes, there are facilities like that. Here in Canada, the way facilities work, you have private facilities that are privately owned, and then you have government owned facilities that are public. And the public facilities and the private ones are very, very different. In the private facilities, they usually don't really take people who use Hoyer lifts or anything like that. Most of them are able to walk, are able to pivot, and things like that. And they don't really take patients that require like more advanced care. So the most you'll have to do is maybe do like a wound dressing or something like that, because it doesn't fit in their budget. IVs and pegs and all these things does not fit in their budget. So yes, there are facilities where patients are like they're not really sick like that, and all you have to do is give them their meds or maybe give them insulin, and if you're lucky, maybe take their vital signs, or do a wound dressing. But that is the most you'll have to do. And in a facility like that, you can easily lose your nursing skills. So for this last one, you guys might say that I'm contradicting myself a little bit, because in the beginning I did say that you could make good money as a nurse, but or you can make good money in long-term care, but that is not always the case. It's not always the case, especially if you live in Canada, where like I said, we have private and public facilities. In a public or government-owned facility, you are obviously going to get more money because it is government. Whereas in a private facility, like I said, these facilities are privately owned, and they don't have the budget that these public facilities have, and so they pay a little bit less. It's not a significant amount, but they pay less. Now you might be wondering, well, why would I want to work in a private facility if I'm not going to be making as much money? And that really depends on you. Personally, currently I'm working in a private facility, and I'm only using it as a stepping stone. I'm using it as a way to kind of, like I said, ease my way into working independently, make some money, because like I said, hospitals are very, very competitive. And so I'm just, waiting to get a little bit of practice, get used to working on my own before I decide to leave. So that's the reason why I personally work in a private facility. But another reason why some people work in private facilities is because in private facilities, you are not unionized. If you work in a public or government-owned facility, you are taxed. Well, here in my province, we have 2 taxes to pay. You have the TVQ and TPS tax to pay, and then you have your union dues to pay, which is a lot. And then you also have a mandatory insurance to pay. Here, a lot of people don't really see why they should pay for insurance, because healthcare is pretty much free here in Canada. If you get a medication, the most you might have to do is pay the taxes on it. The only thing that's not free is dental. It is still somewhat covered under Medicare, but there's like some difference that you have to pay. So people are like, well, I'm not at the dentist every single month. I go to the dentist or the optometrist once a year. I can take the L and just pay it out of pocket. And they don't really see why they should be paying monthly, because it is a lot of money. I think I was paying like $100 per paycheck for my insurance. That is a lot of money, plus your union dues and plus your 2 taxes. So in a government facility, when you have to pay all these things, for example, if I wanted to make $1,000, like after taxes, after everything was deducted, I had to make $1,650. $650 was deducted out of my paychecks for me to be able to make $1,000. That's really, really tough. Whereas now I can literally work, 6 days, maybe a little bit, maybe 5 days. I can work 5 days, make $1,000, or 5 8-hour shifts, make $1,000, or make $1,200, and then after tax, I'll only get deducted maybe like $200, and then I'll have my flat 1,000. So I can work less days. Well, obviously because I'm making more. I was working as a CNA before, so I wasn't making as much as I'm making now. So that also plays a role. But I can work less days now, make $1,200, and I will get taxed way less, or the deductions are way less, because I don't have union dues to pay and I don't have insurance to pay. I don't need insurance because like I said, in Canada, we have free healthcare. So I don't really need all that extra stuff. I can literally just pay the optometrist and the dentist out of pocket. I go to the dentist once a year to get a cleaning. And I go to the optometrist once a year to get my eyes checked. I didn't even have to get my glasses changed this year. And I think my cleaning cost me like $80. So that's that. Guys, those were the only cons I was able to think about, and I know I'm missing a bunch of them, but I have a complete blank. So like I said, feel free to leave them down in the comment section below if you guys want to add anything. That is the end of the video. Like I said, I'm going to love you and leave you. I really hope you enjoyed this video. Don't forget to like, comment, subscribe, and please turn on your notification bell so you won't miss another video from me again. And I hope to see you in my next one. Bye.